I'm Brittany McGinnis. I'm a nurse practitioner student from Auburn University. Today we're going to discuss the role of a nurse practitioner. So today I have with me Chris and Sarah Hammock. They work as an IT director and Sarah is an elementary school teacher. So what we'll do, I'll start us off with one question, and once we're done with that, I'll have you guys rotate drawing questions out of the jar, and then whatever you pick, if you'll just answer it the best you can. If the other person has some input, just go ahead and speak up, and then I'll clarify the correct answer. So can you guys tell me what FNP stands for?
I'm gonna say something nurse practitioner.
Family nurse practitioner.
Right. So FNP is a family nurse practitioner. You do have to be board certified and take a national licensure exam, which I have that to look forward to. NPs make up more than 25% of the rural healthcare providers. And by the middle of the decade, there are projections that 1 in 3 nurse practitioners will be primary care providers. So some of the history: in 1965, that was the first nurse practitioner program, and that was at the University of Colorado. It was a pediatric program, so that's what's unique about the family nurse practitioner. Other specialties, pediatric, neonatal, geriatric, women's health, etc., those have a dedicated patient population where family can see kind of across all ages. Moving on with the history, in the 90s, there was just a continued fight for legitimacy in the healthcare field. And then by 2000, nurse practitioners were legally able to practice in all 50 states. So 1965 to 2000 was the big push to get nurse practitioners legal. So whoever wants to pick our first question.
Can an FNP diagnose illnesses? I'm going to say no.
I'm also going to say no.
So yes, they can. So they are, under state practice and licensure laws, able to evaluate patients, diagnose. I'm not going to give the full definition because that'll spoil some of our future questions, but yes, they're able to diagnose illnesses.
Can an FNP do simple office procedures? I'm going to say no.
Yes.
What are you thinking is a simple office procedure?
I'm thinking anything procedure is something to do with surgical.
Okay. What do you think?
I think like testing for sicknesses like the flu and strep. I also think like maybe like removing a mole, freezing a mole, something like that.
Okay. So they are not allowed to do complex surgical procedures, but they can do simple office procedures. So some of those things, I was reading that 50% or more of FNP programs, so that's like the education program, they teach about procedures such as pap smears for females, testing visual acuity, so looking at how well you can see, your 20/20 vision, 20/40, whatever it may be. Audiometry is testing the hearing. They are able to splint extremities, so if there's a broken wrist, broken ankle, you can splint that and then refer them out to orthopedics or whoever needs to treat the issue. They can interpret 12-lead EKGs, interpret blood gases, which checks your oxygen and CO2 level in the bloodstream. They're able to do single-layer wound closures, so that's like simple sutures, and then apply local anesthetic to those areas to numb it up. And then the last one they listed was fluorescent staining of the eyes. So if someone comes in with a complaint of they scratched their eye, there's something in their eye, you can apply dye to the surface of the eye and look at it under UV light, and you can detect those scratches and stuff, which I got to see in clinical last week, which was neat. Yeah, go ahead.
Do you think an FNP has to collaborate with a physician? Yes.
I'm gonna go yes.
Depends on the state. I have this map here from the American Association of Nurse Practitioners, and it kind of details the 3 levels of practice. So there's full practice, reduced practice, and restricted practice. Which category do you guys think Alabama falls under? Full, reduced, or restricted?
Restricted.
I'm gonna go with reduced.
So it is reduced. So their definition of reduced practice is that state practice and licensure laws reduce the ability of NPs to engage in at least one element of NP practice. State law requires a career-long, regulated collaborative agreement with another health provider in order for the NP to provide patient care, or it limits the setting of one or more elements of the NP practice. So yes, you do have to have a collaborative physician in Alabama. Okay.
What is the difference between a NP and a PA? So I know what a nurse practitioner is, but I assume a PA is a possible physician assistant.
Yeah, that's right.
Okay, so if that's the case, I feel like an NP doesn't necessarily have to have a doctor in a room, but a physician's assistant does.
So a nurse practitioner can treat patients, but a physician assistant assists the physician.
Okay. So they can both see and treat patients. The main difference is their approach to care. So physicians assistants are more medical minded. They're gonna order tests, diagnose, treat. They can specialize in an area of medicine, where the nurse practitioner is more with that background of nursing in the patient-centered care and their approach to medicine, and they can specialize more in an area of population versus a medical area. Does that make sense?
Yes.
Okay.
Can an FNP write prescriptions? Can an FNP prescribe narcotics? I know they can write prescriptions, but I don't believe they can prescribe narcotics.
I think yes on both. I mean, if they can do small procedures and diagnose, I believe that yes.
Okay. So they can write prescriptions, and under certain regulations, they can prescribe narcotics. So 27 states plus Washington, D.C., they're full practice, so they're allowed to write anything. Alabama is the reduced practice. So you have to have meet certain criteria. Your collaborating physician has their own set of criteria for their nurse practitioners. You have to obtain a DEA number in order to write those controlled substances. And there's different schedules or levels of controlled substances. So those control 2s are the highest potential for abuse and can lead to severe psychological and physical dependence. So that's why there's, some states are still hesitant to just allow that to be a thing, just for safety purposes.
Can a FNP bill for their services? I'm gonna say no.
I think it's billed under the main doctor.
Okay. So there's different stipulations. So they can bill for themselves. That's called direct pay. That's where the nurse practitioner has their own provider identification number, or a PIN. And when they bill under that direct pay, then you're only going to get 85% of what a physician billing rate would be. So you don't get that full 100% reimbursement. There's also incident 2 billing, which is where the nurse practitioner kind of follows behind the physician. The physician's already made that initial diagnosis, has started the plan of care or the treatment plan, and then they're coming in behind. So the physician can bill and collect 100% of the allowable reimbursement. And then the other billing category is shared or split services, which allows the practice to bill under the qualified physician versus the nurse practitioner at that lower reimbursement rate. And as long as criteria are met, they can allow that extra 15% of reimbursement, which would make the 100%. So they can bill, there's just different ways.
Can an FNP order a diagnostic test? Yes.
I'm also gonna go with yes.
Okay, so yes, that's correct. So the scope of practice does allow diagnosis and treatment. You need those diagnostic tests in order to make that correct decision to treat in the correct way. So you have to become skilled in knowing what to order, when to order, how to use that data to diagnose and be able to interpret those tests as well.
Okay. Can an FNP manage chronic and acute illnesses? I'm gonna go with no.
I know they can treat, but I don't think they like manage long term.
So the chronic stuff.
Yeah.
So they can do both chronic and acute illnesses. So your chronic's going to be more like hypertension, diabetes, high cholesterol, versus acute is more of your viruses, your sinus infections, more short-term illnesses. So they are able to manage those things. Reading one of the reviews, it said that patients who are treated with an NP and physician team actually have better care versus just the physician practicing alone. So a lot of times it's hard to get in to see your primary physician, but if nurse practitioners are there to fill that gap, they're more available, they're less expensive for businesses to have, then they're able to manage that more chronic progression, keep patients out of the hospital, you know, as a main or a final goal, but keeping those chronic and acute things at bay, I think can be better managed with nurse practitioners in the field. So looking at our last question, I know we've discussed this some, but I have the map here of the full, reduced, and restricted practice. Green is your full practice, yellow is your reduced, and red is restricted. So is there anything that kind of sticks out to you guys about the areas, like geography, or things you may know about those states?
A lot of the states that I know, I believe, have like a large number of like narcotic abuse or prescription addiction, and so I feel like that's why they're probably restricted or reduced.
Okay.
I see most that are full practice are in the West. I also noticed that the restricted practices happen to be the two largest states, I think, in the United States, with Texas and California.
Mm-hmm. What I kind of think about is the full practice states, a lot of those are more rural. So out west, I think having the full practice, which allows the nurse practitioners, you know, to do everything, I think that just makes healthcare more available to those people in those rural areas, which, I mean, here we have rural areas, but I feel like those states as a whole would have more of the rural population. So thinking about this, what we've discussed throughout this assessment, do you think that all states should be full practice?
I personally think that I would say yes to full practice, 100%.
I would say yes too.
Okay. I think so too. I think there's a lot to consider, and it would be good to look at, you know, the ones that have been full practice, you know, how do they do it? What benefits do they have versus these reduced or restricted states? But as far as our aging population, growing chronic diseases, we're living longer, but we're having more issues, as well as healthcare costs, I think having full practice for nurse practitioners across all 50 states would be beneficial.
Okay.
Any other questions?
I think I'm good.
All right. Well, thank you guys for taking time with me.